Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of MuscleCare. I see 55,000 patient visits a year in my practice. We understand pain. If anyone you know or love, your family or friends suffer from low back pain, please give them this mini series of stretches. It will help dramatically. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that we're warmed up, let's get some relief from our low back pain. For the front of chest stretch, your right arm should be perpendicular, parallel to the ground, and you would actually try to hook your hand onto a wall for support. And if you can extend your fingers backward in order to open up the fascia and connective tissue of the forearm and the hand, you'll get a much better stretch all the way up the arm, all the way through the chest. But remember, what you want to do is feet are planted square on the ground, and you rotate your body away from the side you're stretching. That includes your neck. So if your right hand's on the wall, you'll turn your face and your torso to the left. Okay, do the same thing on the other side for balance. What we're going to do now is a torso stretch. Hips should be right under the shoulders, ears should be right over top of the shoulders, and you'll do a torso stretch. You can hold your hips and just twist the spine and the neck all the way up to the top in rotation to the left. Do not move your hips. As you've done this stretch and you've held it for 30, then for more stretch, you can turn your pelvis further to the one side. Do both stretches equally on both sides. For the side of spine, make sure that you actually open up your legs. They're wider than shoulder width for stability. Put your left hand on the left side of your lateral left leg or hip. The right arm goes straight up in the air and you lean to the left side. So your right arm should be pointing to the left and it should be straight all of the time. Do both sides exactly the same. Now, for the front of leg or quadricep, we call it stretch, what you want to do is you want to make sure that you're standing holding a wall with one hand, the right hand, and then you'll pull your left heel up to your buttock and you'll grab the front of the ankle on the left with your left hand. Try to hold that foot and heel as close to your left buttock as humanly possible, and that's when you go through those Super 6 rules of stretch. Now remember, again, this may be tight, you may not be able to get it all the way there. It's not essential that you touch your heel to your buttock, just as long as you feel the front of leg stretching. Do both sides. Once we want to do our hip flexor stretch, we can roll directly from our front of thigh or quadricep stretch. We can put our right hand on a chair for support. And all we do is, as we want to stretch our hip flexor, it's important that we try to pull our left leg back. So the left thigh, you're trying to get it closer and closer to parallel to the ground as you hinge at your waist and you move forward. So when your body is really doing this well and your hip flexors are stretched out, you'll be able to make a T. Your right leg is on the ground, that's the bottom of the T, and your torso and your left thigh create the top of the T. Put that right foot up so the heel is on a chair. Start with that, keep the leg perfectly straight. Don't bend the leg. You want to stretch the connective tissue in the back of the knee. This is what everybody misses. So if you do that and you're getting used to that at that level, that height of the chair, then start to hinge at the waist and lean your body forward. Don't round the shoulders, don't round the neck, hinge forward. Put more stress on that hamstring to stretch. That's an effective way for those that have, again, balance issues or dizziness or vertigo problems. Some people call it a sun salutation in yoga, where you lie on your tummy and you up on your elbows, you arc your back so you get your back to extend, because most people don't do that in the course of their day. And as you get good at that, you can actually go up onto your hands and arc more, and leaning your back of the neck backwards even further, because we're always looking down at our technology. Let's get that front of neck to open up. That's a fantastic way to get the spine moving in extension. That's a great core exercise series. Good luck with that. For an effective side of leg stretch, remember that the iliotibial band, tensor fasciae lata, very, very, very tight adhesive sort of tissue, because that stabilizes your pelvis so you don't fall over. So those stretches take a little longer and you've got to be patient. So you stand facing away from a wall, put your left hand on the wall, And what you'll do then is support yourself. Now, your left foot stays planted on the ground. Your right foot crosses in front of that left leg. And then what you'll do is your right hand goes on your right hip, and that pushes the hip toward the wall, but you're stabilizing and holding the wall. This way you're gonna be stable and you're not gonna fall, but you're gonna have to breathe deeply for at least 30 to 60 seconds. Notice I said 60 because fibrous tissue doesn't have a lot of blood flow. Blood flow brings magnesium into those tissues and helps them relax. So again, it's gonna take longer than an average muscle. Do both sides. Next of all, we're gonna do a hamstring and back combination stretch. That's where we bend over and touch the toes. Now, feet shoulder width apart and hinge at the waist so that you can drop and relax your whole body. Reach your arms down as far as they go. Let your head hang. Don't tighten up your neck, let it go. Distract the neck and open up the disc spaces. So again, let your body hang. If you can stay there for 30 to 60 seconds, breathing deeply, that's a fantastic calf, hamstring, buttock, and lower back stretch. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? MuscleCare is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're gonna love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.